The views or opinions expressed on Ann Arbor Inclusive do not necessarily reflect the views or opinions of the City of Ann Arbor and the Commission on Disability Issues. For more information about the Ann Arbor Commission on Disability Issues, please visit a2gov.org/disability resources.
Hello everyone and welcome to Ann Arbor Inclusive. I'm Zach Damon. We have a wonderful show for you today as Taylor Tinkham, the Health Management Coordinator at the Ann Arbor YMCA, joins us in studio. Well, Taylor, let's get rolling, shall we? So, first of all, the Ann Arbor YMCA, it opens in 1858 by students at the University of Michigan and was the second YMCA in the state of Michigan after the Detroit YMCA. But on April 1st in 2005, the current Ann Arbor YMCA facility at 400 West Washington Street, which I think is just such a beautiful facility, is open. So how long have you been involved with the Y, and what circumstances led you to becoming involved with the YMCA?
Well, I've been with the Y for a little over 2.5 years. I graduated from college and had a few different jobs, but was really drawn to kind of the fitness piece and the health and wellness piece of the Y. Little did I know that it's a nonprofit organization that is global and really just more than a gym. And so I truly fell in love after that. Yeah.
And you talked a lot before the show about how the Y is sort of a family and how all of you that work together, as well as those that come to the Y regularly, you guys are a family. So can you talk about, for those that have not been to the Y before, why that's important?
Yeah, we really strive to be a welcoming facility.
Sure.
And so we have classes and programs for every person. And when you walk into our building, you'll hopefully find someone that you can relate to.
Sure.
And not only our building, but all of our off-site locations. We have 25 different sites. Now,
wow.
those aren't big Y facilities like
Sure.
our one at 400 West Washington, but they're
Sure.
schools, they're senior centers, and we do a number of classes and programs out around Washtenaw County as well as up in Burt Lake where our Camp Algonquin is.
Sure.
So we're everywhere, and we hope to reach every kind of person.
Now, did you attend Camp Algonquin when you were younger?
I did not.
you did
I
not.
grew up in Minnesota, but I did attend a Y camp there.
Oh,
It
my
was a day
goodness.
camp.
And you enjoyed it?
Yes, definitely.
Yeah.
They're wonderful.
Well, what are the advantages of going to like a summer camp, with the Y? A lot of people say, oh, but there's other ones out there too, but why the YMCA camp?
Well, at camp, you get a similar experience to walking in the building in that you have every kind of person at camp. We offer tons of different programs at all of our day camps and our sleepaway camps, so horseback riding and rock climbing and book clubs and all kinds of different
Sure.
things. And we also offer scholarships for all of those programs, which is a huge part of our organization's goal and what our annual campaign is all about, is sending kids to camp to get that camp experience. So, you get a whole new world at camp.
Sure, and get to create timeless memories, I'm sure, as well.
Yeah, definitely.
So, and then I wanted to talk about, too, because you talked earlier about programs in your last response. And so the big program I'd like to talk to you about now is the Diabetes Prevention Program. You're the coordinator for that at the Ann Arbor YMCA, and it aims to prevent or delay the onset of type 2 diabetes through lifestyle changes. So my big question to you, why should diabetes be on everyone's forefront of thought in Ann Arbor?
Well, in Ann Arbor, yes, but I mean worldwide and especially nationally. So as you probably know, type 2 diabetes, one of the risk factors for getting type 2 diabetes is obesity or being overweight. And in our country, a third of the people in our country are overweight.
Wow, a third.
Yeah. Actually over a third. And 89 million people are actually pre-diabetic.
Do they know it? Excuse me. Do they know that they're pre-diabetic?
Most of them do not. Only 9 million
Wow.
know that they are pre-diabetic. And pre-diabetes is, you're not in the range when you get your blood work done.
Sure.
You're not in the range for diabetes, but you're getting there. And so it's really important for people to be aware of that, to get that blood work done.
Sure.
Go to their labs, go see their doctors, and find out what those numbers are.
Wow. I mean, it's interesting because when we spoke before the show, again, you mentioned that the YMCA has a partnership with the CDC, or Center for Disease Control, and then the National Diabetes Prevention Program, makes it easier for people in Ann Arbor to participate in, as you said, affordable and high-quality lifestyle changes and programs at the YMCA in order to reduce their risk and their overall health. But can you share how the YMCA kind of got involved with this program? I mean, were they always involved with diabetic prevention?
Well, the Ann Arbor YMCA got involved in the diabetes prevention program in 2012, but it is an evidence-based program.
Sure.
And that's something that we really, really focus on, and is a movement across the country, is these evidence-based programs. So there's a lot of research that went into the diabetes prevention program, and it is something that the CDC, the curriculum is created by the CDC.
Sure.
And so there are other places in our area that actually run the diabetes prevention program as well.
Okay.
The National Kidney Foundation, there are some clinics at U of M that do, and it's the same curriculum as the Y.
Okay.
But the Y has kind of Y-ified it, as you might say,
Sure.
or as we say. And so we're really more and more drawn to these evidence-based programs. Two of the other programs that I run that are evidence-based are Moving for Better Balance, which is a fall prevention program,
Okay.
and then Enhanced Fitness, which is an arthritis exercise program. We also have Healthy Hearts, which is blood pressure monitoring. So we're really moving into this world of prevention and having really strong research behind the programs that we run.
Sure, and I think research is definitely important. I mean, when you're implementing all these programs and, of course, offering the services, you want them to be as beneficial as possible. So I think having the data to back that up is extremely important.
Yeah.
So lifestyle changes seem to be a huge common goal for those involved in the program. What tips can you give those watching as to what lifestyle changes they can make into sort of helping prevent diabetes?
Yeah, well, our program is really focused on preventing, or at least delaying, the onset of type 2 diabetes. And we do that in our program by having two goals.
Okay.
So the first one is a 7% weight loss. So people at home can maybe think about what that might look like for them, do a little math.
Sure.
And then the other one is slowly increasing our physical activity up to 150 minutes per week. And that's the equivalent of a brisk walk. So we're not asking anyone to jump into our high-intensity interval training boot camp class
They're
at the
not
Y.
going to go run a 5K right away.
Right,
Yeah.
no. And we do have those opportunities at the Y. Like I said, we have every type of class. And so if that's for you, go for it.
Yeah.
But that's not what we're asking the people in our program to do. So the equivalent of a brisk walk, a nice moderate pace. Some people choose to swim. Some people choose to dance. It's totally up to them. So those are kind of the two goals. And then the other thing that's such a huge part of our program is tracking what you eat.
Okay.
And you've seen probably a lot of Weight Watchers, those
Sure.
types of programs that ask you to do that. And there's a really real reason why they ask you to do that. And the biggest piece of it is just creating awareness. So many of us are mindless eaters. We
Sure.
sit down on the couch with a big bag of potato chips and you don't even notice, and then you look down and it's gone.
Yep.
And so creating awareness about what we're putting in our mouths is so important, and that's what the tracking really helps us do.
Sure. My grandfather always said, he said, "I'm on a seafood diet, Zach." And I said, "What is that, Grandpa?" And he said, "Well, when I see food, I eat it." But it's very important to not really be on that. And again, to, as you said, pay attention to what you eat, pay attention to that exercise, and, and that 7%. Is that 7% really, really important? I mean, when first starting the program?
Yeah, it's kind of a magical number.
Okay.
So people that participate in our program and really follow it, have a 58% chance less likelihood of getting type 2 diabetes.
Okay.
And actually, if you're 60 or older, that goes up to 71%. So it's extremely effective.
That's wonderful.
Yeah.
Now, the big question, too, that I have for you is, it's a wonderful program. You've talked and said great things about it. However, what is the age range of this program? I mean, are children allowed to join this as well? Because, as you know, childhood obesity has been unfortunately on the rise. And, of course, this is a town with a lot of children and high schools as well. So do you offer that to children and young adults as well, or is this primarily for seniors?
It's for anyone 18 and older.
Okay.
And we have quite a wide range at our Y.
Sure.
We've had people who are 22 to 78.
Wow.
I looked that up yesterday. So yeah, we've got a wide range. I mean, I will say our daytime classes are a lot of retired seniors.
Okay.
And then our kind of post-work time classes are more working age people. So if someone is interested in joining, we can always work with them to find the class that would be best suited for them.
Mm-hmm. Do you find this position that you're in extremely rewarding? I mean, because I talked to you again before the show, and it's one of those things where I was just blown away, because you're not only helping people immediately, but you're helping prolong their life. And so, you know, for you, I mean, what motivates you to sort of continue to get up every day and go to work and knowing that you're giving back? I mean, am I sort of putting the words in your mouth?
No, I mean, yeah, definitely right. It's extremely rewarding. I'm lucky enough to coordinate the program, but I'm also a facilitator or a lifestyle coach for the program.
Sure.
And I think that's really key, and that's what makes my job so easy, is that I'm there to facilitate. I don't get up in front of the group and write on the whiteboard and people take notes, and I'm not a lecturer.
Right.
I'm there to facilitate real conversation between people and within a group and try to help build community. And so I think what's so great about my job is that I get to watch that evolve, and I get to watch that happen. Sure. And watch people connect. And so that's one of the most rewarding parts.
That's wonderful. Do you ever have people that thank you for the program or for, you know, one of your classes that you're teaching and tell you that it's made a difference? Do you hear a lot of feedback?
Yeah, and what's great is that there's a different kind of topic every week. It's a year-long program, and so we have a lot of time to dig into, you know, the logistical stuff about nutrition and fitness, but sure. Also some of the mental components, the negative self-talk, the social cues that we encounter that make us want to eat, those kinds of things. And so I get to really sit back and watch those conversations happen.
Sure. And can you share a great memory that you have? I mean, I know that you've worked with the Y for some time, but I'm interested because you get to interact with so many people on a daily basis and with your job. Do you have one memory that really sticks out to you as
so
sort of
hard.
Your favorite?
Yeah. In a group that I facilitated, they're almost done with their year now, but at one of our meetings I announced to the group that they had lost, I think it was around 113 pounds as a group, and which is amazing. It was a group of 10 to 12 people. And one of the participants was really excited about that. And so he went out and purchased 9 pounds of potatoes.
Oh my goodness.
And he brought it to group the next week. And he made everyone in the room carry it for a minute just to feel, because that was the average amount that they had lost,
sure.
You know, per person.
Sure.
Just to carry it and kind of feel, you know, how much that really was, because people don't realize 9 pounds is a lot, and carrying that around on your body is such a huge burden. And so it was really powerful to watch, and people loved that. And he did that on his own. I didn't ask him to bring in 9 pounds of potatoes, but it was a really cool thing that he did.
No, that's wonderful. Did you guys end up making anything out of them, or you just used them for the workshop?
We didn't.
Oh.
We did not make any mashed potatoes or French fries,
Oh
that's
my
for
God.
sure.
Well, yeah, right. You don't want to do that.
Yeah.
Those are bad carbs. But no, but it's great to have sort of responses like that, to where people bring it in and sort of give you, kind of that feedback. In terms of people not knowing much about diabetes, I mean, I think that it's really important too what you're doing in terms of educating the population about that. Do you run into people that are diabetic that didn't even know it?
Oh, yes, all the time. And unfortunately, our program wouldn't be one for them. Diabetes is a whole other thing to deal with. Pre-diabetes, you may be put on some medication, metformin or something like that, but we have a lot of people in our program that are trying to prevent diabetes and trying to not have to go on medication.
Sure,
and so,
sure.
If we encounter someone who has been diagnosed, we have a lot of other support in our area that they can, reach out to for help with that.
Sure. And we spoke before the show too, and you told me that type 2 diabetes, if I'm correct, that's the one that can actually be reduced or
Yeah.
reversed, actually, yeah. And by changing your lifestyle, exercising more, changing your diet, so that's actually true.
Yeah.
It can be reversed.
Yes.
Wow.
Yeah, it's an amazing thing. Just with some lifestyle change, some awareness, you can definitely do that.
Sure. That's amazing.
Yeah.
So if someone's interested in becoming involved with the YMCA and with the program, what would you say to them, and why would it be important for them to become involved? And I mean, do they have to be a member of the Ann Arbor YMCA to get involved with the diabetes prevention program, or do you provide assistance for that? I mean, how do they get involved?
Yeah, we have assistance for both the program and memberships of the Y. So as a part of the program, you actually get a family membership, which is amazing because we really want to encourage people, if they have a support system at home, those people should be able to come with them to the Y and be there to support them. So that's something that we offer as a part of the program. If they're just interested in becoming a member of the Y, we give tours anytime we're open. They can pop in to the front desk and ask for a tour, and someone can show them around. If they have specific things they're interested in, the pool or group classes, we always have someone there to answer those questions.
Wonderful.
As far as the program, there's a little bit of an intake process.
Okay.
And so they can give me a call or they can shoot me an email. We get a lot of doctor referrals now for our program, and so if they are seeing a doctor in the Ann Arbor area, they most likely know about our program and could write a referral for it and fax it over to me. We do have financial assistance, like I said, for both memberships and for the program, up to 80%.
Wow.
Based on your income and your family size.
Sure. So even if you'd say, oh, well, our finances aren't what it is right now, we can't get involved, you guys say, actually, no. We'll pay 80% of it. All you'd have to do is come up with the rest. Please get involved. And that's wonderful.
Yeah.
That's
yeah,
wonderful.
We don't want to turn anyone away from this program.
Sure.
It's really, really important. And we've found that people who are a part of the program are not only making changes to their own lifestyle, but they're bringing it home. We actually have a participant now whose family is abroad. He moved here to work and became a part of the program, and he has been Skyping them and giving them all the information from our program, and his family, his parents, have lost over 40 pounds each at home.
That is amazing. And that's through the internet, so they're not even there physically to be there in the class, but they do this all over Skype across the world.
Yeah,
That
really
is
amazing. Yeah.
Wow. Now, have you had them sort of speak about the class and how it's beneficial? And
Yeah, I mean, I haven't spoken with his parents, but we've had a number of people who have done kind of interviews with us about how they feel about the program and why they enjoy it. And I think the biggest part is that community that's built in the room. I mean, we have groups who have completed their year but continue to get together and have healthy potlucks and go on walks and those kinds of things. So it's a really wonderful place to make some new friends that potentially could be going through some similar experiences.
Sure. What kind of food is at a healthy potluck? I'd like to know. What is that?
Well, we focus on, in our program, we focus on low fat.
Okay.
And so, we've had groups make cookbooks that are low fat cookbooks, and so it would be low fat, whole foods, nice veggies, fruits, whole grains, that kind of thing. Good
That's wonderful.
proteins. Yeah.
That's great. It sounds really good.
Yeah.
So that's amazing. One of the other questions, too, that I wanted to ask you, I mean, you told me before the show that you actually teach other classes as well. And so can you talk a little bit about that? I know you said something to me earlier about a class that was called Pound.
Yes.
So I'd really like to know about that.
Yeah.
Could you describe that for me?
Yeah. The Y is an amazing place because, sure, I'm the health management coordinator.
Sure.
But I also teach Zumba, which is a dance, kind of Latin dance fitness,
Sure.
and then Pound, which is drumming. We use these bright green drumsticks and we drum on the ground and we hit them together in the air.
Yeah.
But I also help to manage our gardens, our learning gardens. So where else could I get a job where I get to, help people become healthier and also do things that I love in gardening and teaching those classes. But we have such a wide range of classes, and like I said, not only in our facility, but in Ypsilanti and just all around Washtenaw County that adults and kids can get involved in.
That's wonderful. So just because you are the diabetes prevention program coordinator, it doesn't mean that that's all you deal with.
Oh,
is
no. Yeah.
Diabetes prevention. You do a lot of other things.
Right.
Yep.
Yep.
That's wonderful.
People at the Y all wear many hats, but it keeps life exciting.
Now, when you go to the Y and you go to work out or you just go by yourself, you're not working, you're not doing any activity, where do you go? What's your favorite spot at the Washington location?
Well, I actually learned how to swim at our Y.
Really?
I did not know how to swim. I could doggy paddle maybe, but our aquatics director spent time with me one-on-one and taught me how to swim. And so the pool has become my happy place. And it's a very warm pool. We have two pools actually. We keep one at 90 degrees and one at 82.
Wow. And
one we use for arthritis exercise, the very warm pool. It's
Sure.
great for the joints. So the pool area is great, and I've really grown to enjoy it now that I can swim.
Yeah, I mean, how was that process for you, sort of learning how to swim? I mean, was it difficult
Yes.
to learn how to do that?
Yeah, the whole breathing, the rhythm of the breathing is a hard thing to learn, but
Sure.
totally worth it now.
Wonderful. Well, I definitely want to thank you, Taylor, for joining me and joining us. And folks, that's all the time we have for today. But again, I'd like to thank Taylor Tinkham of the Ann Arbor YMCA for joining me, and hope that you enjoyed the program. And please be sure to tune in to Ann Arbor Inclusive next month. Stay awesome, Ann Arbor.